Good evening, everyone. This is Mac here, and I welcome you all to my YouTube channel, which is called Mac Vlogs. For this evening, we have another guest all the way from USA, New York City. Her name is Dr. Sadaf Lodhi. She is a gynecologist, and she is a great doctor, which I came to know from a friend of mine. So I want to welcome her because she wanted to talk about gynecologists, the subject for the woman, so that she has some solutions for them if they have any problems and the issues they are facing during the pregnancy time. So let us welcome her on MacBlogs now. Good evening, Dr. Sadaf Lodhi. How are you?
Good evening. I'm doing good. How are you?
Pretty good, pretty good. I think it's early morning. It's 11 a.m. in New York City and it's 9 p.m. here in Karachi. So all what we are seeing is that we got you up early. I guess if it's your working day, so I'm sure 11 a.m. might not be that so early for you.
Yeah, no. It's good. I'm an early riser, so I'm up and ready to go. Thank you so much for having me on your show. I really appreciate it.
It's an honor. It's an honor, basically, because that's what MacVlogs do: connect and promote people around the world. So, who is Dr. Sadaf Lodhi? We would like to know from your side, who is Dr. Sadaf Lodhi, and what is she doing in US?
Thank you. So, my name is Dr. Sadaf Lodhi, and I am an OBGYN that's been practicing for about 21 years. I
Wow.
actually, I was born in Pakistan, Multan, actually, and
Oh, okay.
yes, and I was fortunate enough. My parents were able to come here, and I grew up in Michigan. I went to the University of Michigan and then Michigan State Medical School and did my training all out in Michigan. And then once I got married, I moved to New York and have been in New York since. So I'm a practicing OBGYN here.
Wow. So, what fascinated you to come live online to talk about the subject? Because you're a specialist, you are a specialist, you did specialized in being a gynecologist. Am I right?
Yes. Yeah. Yep. So I'm really interested in actually giving back to my community and specifically my heritage and the country that I love, which of course is Pakistan. And I'm interested in bringing virtual healthcare to Pakistan and
Okay.
specifically women's health. I think it's very important sometimes. Um, women don't have access to information or somebody that they have a question they want to know answers to, and they may not be able to get in touch with their own doctor. So I like to be that person that they reach out to and ask questions, and kind of be like their friend, hold their hand, guide them if they need it, and give them advice as they want it, and something that I'm really excited about doing.
Wow. But being in US, don't you think that it's been so far away and being the timing could be an issue? The morning yours and the evening here, and if it's morning here and it's nighttime yours. So how,
Absolutely.
as far as the logistic is concerned, if getting back to your uh, patients, I would say more like if they have any questions and all. So how are you going to look that into the account?
Sure, of course. So I'm just heading up my website, and I have these great people helping me out doing my branding, and so they've just set it up such that there's a calendar. So if you go on there, you can book an appointment, and when you book the appointment, it'll also convert that time, and I'll look into how to do that, convert that time into Pakistan time, so that we can coordinate times. And early mornings probably work better for the US time, and late evenings for, Karachi, Pakistan time. So, I mean, there's always a way to connect, and there's always email. I mean, there's a connection wouldn't really be, the problem. I think the most important thing is getting out the message and letting people know that, I'm available, and that if they had questions about OB or GYN or family planning, contraception, any of those things, that they have a resource that they can reach out to.
I see. So where do you find in today's world the young women are not becoming pregnant very frequently? They're taking their time out, maybe 5 years, 6 years, because they don't want to spoil their figure. That's one of the questions which came to my mind through someone, which I wanted to ask you. That why are the women delaying becoming a pregnant, which should be a natural process?
Yeah, I mean, I think that, women definitely, everyone has their, they can decide to get pregnant whenever they want. I don't think that, society should be instructing women when they should or can or, have a child. I think a lot of women actually delay pregnancy because they're focusing on their careers, their education, and sometimes having and taking care of children is a very big responsibility. It's a huge blessing, and it's I think women that have children end up sacrificing a lot, in terms of their sometimes their education, sometimes their career. And so I think some women decide to either not have children at all, or have children when they're able to have children or when they want them. I don't think I don't think it's fair to say that it's that they don't want to do anything to their figure. I don't think that has as much to do with it as it does their own career goals and what their aspirations are, and the value that they bring to society.
But here in Pakistan, I be very honest that what I'm seeing from the young women are that they don't want to spoil their figures, they don't want to become mothers early, they don't want to be get into the sort of a position where the responsibility becomes really difficult. You know how the joint family systems are, or maybe you can say the financial aspects as well, where a lot of women and the husband delays the process of having a child.
Yeah, I think that that's a whole, different conversation, and I think that it's probably individually based. It's really what the woman wants to do with her life, and I think that we as a society, it's easy to pass judgment, but I don't think that we should. I think that we should let women decide for themselves when they feel it's appropriate, and maybe some women don't want to have children. I mean, that's really a choice of theirs that they make. And I
Yeah,
think that,
as you know, in Pakistan, it cannot be your own choice. When you're living in a joint family, you get lots of pressures from all
yeah,
sides, all
yeah,
corners. That why we're not getting a grandchild, why we're not having a child.
yeah,
These
yeah,
sort
no,
of question
absolutely.
puts the woman and even the husband in a very strange positions.
Sure, sure, sure. Yes,
And
no,
I
so,
think you
I
want to
mean,
play a role. I think you want to play a role for Pakistani women for the health sector in Pakistan. I'm sure with your advisory, your way of looking at the whole scenario, it's going to be totally different. So, what role do you think that Dr. Sadaf Lodhi can play in changing the mindsets of the woman being in Pakistan? And how do you see that your role can really define them to come forward and discuss whatever their setbacks are?
sure. So, I really think it's about empowering women. I
Hmm.
think that it's about education. And I think that, once people have a voice, women have a voice, and they're able to use their voice and educate others, their family members around them, about what their choices are. I think that's really the important thing, and I think to know that there are other women across the world that support their decision, I think that's empowering, and that's very important. I think that sometimes when we have discussions with women, it can be very lonely, right? A patient comes in, she has a question, she has a concern, and she thinks that she might be the only one that's going through that. And I think it's important for other women to know that, everyone struggles with these decisions, but when you are empowered with education, and what your choices might be, and how if you delay having a child, doesn't mean that you won't have one later on. you know and I think that that's really the most important thing, is education
Well,
and, yes,
yeah.
information.
Well,
Uh-huh.
for the knowledge of Pakistani women, please add on for my audience who we have here in Pakistan and around the world, the Pakistani women's knowledge building, that how you can take them out from the fears. A lot of women go through certain fears. So what message you have for them, that how they can come forward and discuss their situation with you?
So, each consultation. So, if they decided, if, a woman in Pakistan decided she wanted to have a conversation with me, um, she would just book a time. And then all of those conversations are confidential. It's like one on one, what you and I are having, except, this is being broadcast. But, when a woman goes to see a physician, it's a private conversation. It's not something that will be shared with anyone else. It's not something that's shared with a family. It's a one-on-one discussion, and that's how women can feel comfortable discussing whatever their needs and wants are. And it's important to have somebody like that, somebody where you can talk about how you feel. That's important.
Again, this would be very ideal to know for everybody. What is the ideal age for a woman and a man, male, or and the female? The right time to have kids. Can you just define the age group? Because I hear and I keep on get to know, that a lot of people say that after 35, after 40, it becomes difficult for
Sure.
female or the male, for conceive and all.
Absolutely.
So
Yeah.
what age groups do you prefer that the kids, I mean, the male or the female should plan their family, the
Sure.
ideal age?
Sure, absolutely. So I think what you're referring to is perhaps, high risk pregnancies and things like that. So typically what we tell women is that as soon as they feel that they are ready to have a child, they should go ahead and start trying to conceive. Um, Definitely a woman older than the age of 35 is considered to be a high risk pregnancy. So there's, things that go along with that. For example, those women are at higher risk of having high blood pressure, developing diabetes. There's always risk, especially if you start to have a child after the age of 40, there's a higher risk of stillborns. So, that's definitely a concern that most obstetricians will have. And sometimes even women that are in their 20s can have a hard time trying to get pregnant. So it really just depends on what the woman wants, but definitely trying to have a child less than the age of 35 is a little bit better. It's not considered high risk, and over the age of 35 is what's considered a high risk pregnancy.
So when the couple plans for the baby and they want to have some expert like you, they want to come and talk to you about the family planning and stuff. So what message, what advice you give them in terms of the health related issues as well? Because at times the child, I'm sorry, at times the woman gets really scared, right? Basically because they don't know how the system's going to work from inside and how they're going to be able to bear that issues which a woman go through. I don't want to go in detail. You know it better. So I think you can guide advice on that as well now.
Mm-hmm. So, I think that what happens is that as whenever a woman decides to have a child, a lot of changes occur in the body, and the body actually accommodates, to the growing child, and the child actually gets the nutrients that it needs from the mother, and really, whatever it needs, it just takes. The most important thing is actually to be in a good physical condition, like to be healthy before you get pregnant. So, for example, actually, one of the most important things is to take folic acid. And that's something that I came across. I actually did a medical mission at Indus Hospital in 2019 in Karachi. And I was there with a wonderful group called medglobal.org. And we came there and we were hosted by the physicians at Indus. And we spent a week there. And I actually worked with the midwives over there, and we taught them ultrasound. It was a wonderful experience. But one thing that I noted when I went to the clinic there is that the midwives told us that once a week they would deliver a baby that did not have a skull or their spine was not formed. And that is the result of not having enough folic acid. And so that is, if I could give one clinical pearl to your viewers, is to make sure that you're on folic acid, which is a vitamin, before you even start thinking about pregnancy, like 3 months before. And that's the most important thing that you can do for yourself. That, and also iron. One of the biggest complications of pregnancy and delivery is hemorrhage, postpartum hemorrhage. And so when women don't have enough iron, they don't make enough blood. And so they start off their pregnancies being very anemic. And that anemia only gets worse in pregnancy. So,
I see.
Yes, so it's very important for them to also be on iron. So to start up the vitamins 3 months before you even think about getting pregnant is very important, just to have them on board and in your system.
Do you suggest any diet plan before the 3 months, before they get pregnant or anything? Do you have any diet plan for them which you feel that they should be having certain nutritious items they should follow before they should plan for the pregnancy? Or
Right.
would you like to say something on that?
Sure. So here in the US, we tell women to take prenatal vitamins. And in those prenatal vitamins, that has all of the vitamins that they'll need. And it has the folic acid that they need and the iron. But those are really the two most important things, is the folic acid and iron. So those are the two most important vitamins to have. Yes. And start taking. Absolutely. Here, most of our...
Do you frequently visit Pakistan, or you just come when you get the call from the doctors or the hospitals here in Pakistan that we need you down here because the conditions or the certain patients have some complex issues?
No, actually, I have been visiting. Let's see, I went to Pakistan in 2008, and then I ended up visiting again 30 years later in 2018. So it was a long time. It was, because of schooling and education, you don't always get that time off. And so in 2018, I was in Multan and in Lahore. And then in 2019 is when I went on that medical mission, and we went to Indus Hospital with Med Global. And so I hope to come back again with Med Global and do another medical mission. But
you want to come back to Multan, or you want to take a tour of whole Pakistan where your services can be utilized?
Either or, it doesn't matter. I mean, I have a lot of family in Multan, and a lot of physicians there. A lot of my cousins are doctors. I have a few cousins that are actually OBGYNs as well. And so, I'd love to go there and see the hospitals there and see the surgery.
I think with your input, you can definitely mention the name of any certain doctors, the female doctors here in Karachi, through my platform now, so that all the female friends, family, relatives of mine, or whoever is residing in Karachi can go and see them, because on the recommendation by Dr. Sadaf Lodhi, then they will have that authentic thing, in their mind that, okay, we're not going to test 10 different gynecologists. We need one who we can just go and discuss all our problems with. Do you have any names in Karachi who you feel they're genuine ones and they can treat all these women out there in Karachi?
Yes. So actually in Karachi, I don't know, because when we went there, we worked with the midwives. So I didn't meet too many OBGYNs over there. But, in Multan, I have my cousin Asma Sajid, and also in Lahore is my cousin Noreen Shokat. So, but I'm sure there's so many, good physicians in Pakistan, and I'm sure if they go, and if your, viewers go online, and they can probably find a doctor that's close to them where they live. That's an OBGYN.
So when can we see Sadaf Lodhi in Pakistan soon?
Hopefully soon. I'm thinking maybe in December I might come out to Pakistan, but right now.
Next month?
perhaps I may come out there with my parents. But right now, I'm launching my business, so I'm pretty busy with that, to be honest. So but I'd love to come back to Pakistan. Pakistan has a
Definitely, we
very
would like
special
to
place.
see fresh minds, fresh doctors, fresh talented people like you who are already abroad, which we are missing in Pakistan because we need to see that professional. We always hear Pakistan have lots and lots of talent, but at times on the ground, we don't see that happening because, you know, I don't want to say this, but it's the fact that the education sector or the medical sector here in Pakistan does not care about their patients or the students the way it should be. It's more of money making business these days, whether it's the hospitals or the schools. But again, since we are talking about hospitals, as you know, the genuine thing should be it's to patient and the doctor relations are more about heart and soul touch, where
Correct.
you can express yourself and be open what you want to share. But here people even don't know how to treat their patients. They just ask you, if it's up to you, we can do it. We get to hear that type of feedback, which is so unprofessional by the doctors who are humans first, But here, when you're talking about saving people's life, I experienced that during this COVID time, many doctors were just filling up the hospitals just because they want the patients and they wanted to show that they're treating so many of patients. But that is not the whole idea. The whole objective, I mean, the whole idea should be the doctors and the connection with the patient should be very pure. Do you believe that?
Absolutely, absolutely. Yes, no, of course. And, patients always come first. And it's very important to me to listen to the patient, find out what her concerns are, what her fears are, what is most important to her, right? And that is of the utmost importance. And then you tailor your care, the physician will tailor their care based on what the patient wants and what she desires. And that's very important to me. And that's how I think, and that's how my business runs. Yeah.
Maybe it's a suggestion. Maybe you can look into that. Why not you start, like, since you're virtual now, right, which
Huh.
you want to do something for Pakistan's healthcare. So why not having your online presence move in Pakistan by having videos and the live conversations and, talking to the different doctors, different panels, different hospitals and stuff so that they can feel that they're connected with professionals out there, which Pakistan is missing at the moment.
Absolutely, 100%. I agree with you. And my hope is that to expand DrSadaf.com and actually um, into something called nowdoc.com, which will have physicians of all different types, internists, family doctors, and things like that, so that more doctors can connect with patients in Pakistan. And that's really the ultimate goal, is to increase healthcare access and equity. And so that people, all over have access to physicians if they want for advice. Of course, we can't replace your doctor in Pakistan. That's not something that we can do, but we can definitely offer advice and consultation, and which I'm more than happy to do. And absolutely, I agree with you. I think that videos, information, education is the best way to empower women and patients in general, right?
So we need you, we need
Yeah.
you, we need you in Pakistan soon, inshallah, so that your platform can definitely be connected with millions of people who needs support, advice, and help by a professional doctor like Dr. Sadaf Lodhi. So we're looking forward to have you in Pakistan soon, whether
Great.
it's virtual or virtual face to face. I'm sure that time will tell. But I think your presence needs really important because all the women out there here in Pakistan, especially in Karachi, which I am residing at the moment. So I would like to connect you with all the women out there of Karachi so that they can talk, come up, and say what they have to with Dr. Sadaf Lodhi. Do you agree that I can play a role in connecting you with the women out here?
Absolutely. I'd love that. That would be so helpful. And, I'd be more than happy to be available. I think that, again, my biggest thing is education and empowerment of women to be able to make their own decisions and to have control over their own lives, right? That's the most important thing, for a woman to understand her own body and to feel empowered. And I think that that's very important. And so I'd love to make that connection and be available to your viewers in Pakistan. They can definitely go online at drsadaf.com and look at my website. It is a work in progress. We just literally got it up last night. My website builders are amazing. That's actually, I think they might be on Mr. Jeff Caldo. And he and his team of his wife, Lauren, and they did a phenomenal job and with my branding, and they've worked really hard to get it up and running just so that patients can go on it and book an appointment if they want and be on the wait list. So yes, I'd be more than happy. And I'm
Definitely. So I feel that I can contribute and play a part in, connecting you to the people around the world or Pakistan, because I feel MacVlogs is all about connecting, connecting. Because as you know, these days people are so selfish, they don't want to talk, right? Or they don't want to connect. But I feel that I can play a role, and which I will play a role of connecting the people to make a better place to live. And that's what Backlogs is all about. That's why we got you down here, so we can promote Dr. Sadaf Lodhi in Pakistan.
Excellent. Well, I'm so happy to be here and thrilled to be a guest on your show. I appreciate your time and having me
It's
on.
an honor. It's an honor, basically, because you, I, everyone are working for humanity, which is the biggest cause, helping out people, finding solutions, finding who to talk to, because these days people don't talk to anyone because they keep all their emotions within themselves, and they are not expressive, basically because they have fears, psychological effect, mental traumas. And as you know, for the last 1.5 years, because of COVID, a lot of
Yes.
people have gone through a lot of stresses after losing
Yes.
their loved ones and stuff. So I feel that it's the right time now, since the things are going gradually becoming normal day by day. So I think we all have to play our role so that humans can bring the smile on their faces and keep them happy again.
Absolutely. I think it's the biggest thing is human connection, right? Everyone wants to make some type of connection with others. And so whether it's in person or virtual, that's the most important thing, is to have connection.
So, what is your best positive message out there for all the women now related to being a gynecologist? And what message you would like to give them through my platform now so that it can be reached to them and they can understand the value of that advice each day? Please, we would like to hear that positive message.
Sure. I think the most important message, I think, for any woman to understand is that she's not alone. I think that it's important that whatever concerns or fears that she may have, it's important to find a connection with a doctor that she can open up to and really say what's on her mind, and know that that information is going to be confidential, and that nobody else will hear of it, and it's going to be a one-on-one relationship with that doctor. And she should also feel comfortable, opening up, and not be afraid that that doctor might not listen to her or understand what she's trying to say. And I also would like to say that, never stop learning. I think that's one of the most important things that I've learned and am still learning, is that education is so important, and that as we all get older, it's important to continue that connection with learning. And so the more we learn, the more we understand about ourselves and others, I think only helps us. And as women learn more about their own bodies and their health, then they'll feel better, right? And they'll feel empowered to speak up. And I think that that's very important.
So all the women out there, I played my role. I got Dr. Sadaf Lodhi on my platform today for all of you out there, so that you can take best advice, and you should start getting connected with her Whoever is pregnant at the moment or who's planning for a baby, who's planning for their kids, whatever your plans are. So I think Dr. Sadaf Lodhi is the right doctor for you all. So that come forward, connect with her if you need her contact details. I'm sure she has already mentioned drsadaf.com is her website. So I will definitely share it on my different social media platforms like Facebook, Instagram, and stuff so that you can start connecting. I can even mention it on the YouTube description where you all can go there and start connecting with her and find solutions. If you have any questions, you can directly talk to Dr. Sadaf Lodhi and find what is best for you all. So that's what I believe.
Thank you so much. Thank you again for having me on. I really appreciate it.
It's an honor. So before you go, this is a very normal practice which I have. Like end of the show, I ask my guests, because they always give their time and honor to me to have them and to host them. So I always prefer that if they can do a small shout out for my channel so that it can be a boost where I can get different speakers
Absolutely.
and guests of different professions so that I can start connecting and make this world a better place, as I mentioned. So a small shout out by Dr. Sadaf Lodhi would be a very honor to and close to my heart.
Absolutely, 100%. I will definitely put a shout out on my social media feed.
Why not now? It would be an honor again.
All right, everyone should watch Mac Vlogs by Mr. Masroor Chida, right?
Yeah. Thank you so much once again, Doctor. So nice of you for your time. I know you need
Thank
to
you.
attend different patients in the US. So everyone, this was Dr. Sadaf Lodhi all the way from USA, New York City. Start connecting with her. And if you really like us, if you really like my channel, please press the subscribe button, the bell icon, and share it in on your platform so that you can all get connected. Connected. Thank you once again. So
Thank
see
you.
you
Yep, thank you.
next time. Bye bye.